Now at 10, developing tonight, city leaders urging vaccinations and boosters after the first confirmed case of the Omicron variant arrived in Chicago. Officials are now mulling requiring proof of vaccinations in more places all around the city.
The Omicron case was discovered by doctors at Rush University Medical Center.
WGN's Mike Lowe spoke with the doctor who discovered the variant and joins us now with more. Mike.
Ray and Dina, good evening to both of you. That doctor said scientists still need a lot more time to study the Omicron variant so that we know what we're up against. But the initial reports suggest that now that it's here, it could spread fast.
A sample that was had been submitted to the Regional Innovative Public Health Laboratory here at Rush was suspicious for Omicron.
Dr. Mary Hayden is the co-principal investigator at Rush University Medical Center's Regional Innovative Public Health Laboratory. She's part of the team that discovered the first case of the Omicron variant in Chicago.
Omicron has many mutations that the other circulating viruses do not have. So because it's very distinct in that way, we could, the laboratory folks could very quickly identify it as Omicron.
Here's what we know about the infected person. A Chicago resident had contact with an out-of-state visitor who carried the Omicron variant. The Chicagoan is fully vaccinated with a booster shot and had symptoms that did not require hospitalization. That person is self-isolating and improving as health officials attempt to conduct contact tracing. With the announcement, Governor J.B. Pritzker issued a written statement that said, quote, "Scientists need time to learn more about the Omicron COVID-19 variant, but in the meantime, we already know how to be vigilant. So get your vaccine, get your booster, wear your mask indoors, wash your hands, and get tested for COVID-19 if you feel sick or have been exposed to someone who tested positive."
Realistically, we are following multiple individuals who we know had exposure.
Dr. Allison Arwady says COVID cases are now averaging more than 800 over the last week, meaning there's a very high risk of COVID-19 transmission. Chicago's test positivity rate is also up to 4.1%. That's an increase from the beginning of November when it was just 1.6%. And in a written statement tonight, Mayor Lori Lightfoot said, quote, "The city and Chicago Department of Public Health continue to closely monitor the Omicron variant and work with medical experts to better inform our residents. To meet the urgency of this moment, it's crucial that our residents continue to get vaccinated and receive their booster shots." Meantime, the new variant is concerning to infectious disease experts like Dr. Hayden.
The thing that concerns everyone the most is just the number of mutations in this particular virus compared to previous variants or versions of SARS-CoV-2, and that some of those mutations have been associated both with more rapid or more efficient transmission as well as with immune evasion.
Immune evasion, that's exactly the concern here tonight, especially with a report out of South Africa tonight that shows that those who are vaccinated may still be vulnerable to the Omicron variant, which is precisely what happened in that first case discovered here at Rush University Medical Center. Reporting tonight in the Illinois Medical District, Mike Lowe, WGN News.
Why it's so concerning. All right, Mike, thank you.